the second most common compression neuropathy in the upper extremity is called cubital tunnel syndrome, and this describes compression of the ulnar nerve at the elbow. So it's kind of roughly around this area of the elbow, that's where the cubital tunnel is. And when you hit your elbow and get tingling into your hand, you've hit what's referred to as a funny bone, and what you've hit is the ulnar nerve. So the ulnar nerve emerges from the neck, and it emerges from the roots C8 and T1, which then travel down through the brachial plexus, and the ulnar nerve travels down the arm through the cubital tunnel and down into the hand. So it supplies sensation to the little finger and half of the ring finger and this part of the hand. That's its sensory function, and its motor function is to a lot of the small muscles of the hand, which are referred to as intrinsic hand muscles, and some of the forearm flexors. So the being able to flex your ring and your little finger like that is from the forearm flexors that are supplied by the ulnar nerve. So when the ulnar nerve isn't working properly or is compressed in the cubital tunnel syndrome, or the cubital tunnel, the initial symptoms of cubital tunnel syndrome will be intermittent numbness and tingling in the distribution of the ulnar nerve. And it is often triggered by flexion of the elbow. And then as the ulnar neuropathy progresses, these symptoms become a bit more persistent, and then if it progresses further, there can be weakness of the hand or the small muscles of the hand, and that may present itself as difficulty with opening jars or reduced grip strength. Another common symptom will be tenderness around the elbow area in patients who have an ulnar neuropathy at the elbow. Now, one of the most common triggers for cubital tunnel syndrome or ulnar neuropathy at the elbow is repetitive flexion of the elbow. And that's because when the elbow is bent, especially when it's in full flexion, the cubital tunnel takes on a different shape and the ulnar nerve simply has less room to move through. And that's how it can get compressed. So for people who, for example, might be on their phone a lot, reading books, that type of thing, involving a lot of elbow flexion, or if the elbow is against something hard while you'd be typing or writing a lot, that can lead eventually to an ulnar neuropathy at the elbow. Now, there is one difference between compression of the ulnar nerve at the elbow versus compression of the median nerve at the wrist. So in prior videos, I spoke about carpal tunnel syndrome. So when the median nerve is compressed at the wrist, it's more of a fixed compression. So there's a band of tissue, the nerve runs under it, and once it gets compressed, it will stay compressed. With the elbow, it's more about the positioning of the elbow. So the nerve is more likely to be compressed when the elbow is fully bent or when the elbow is fully extended. But then when the elbow is in a degree of flexion of roughly 40 to 50 degrees, there is less compression or even no compression of the nerve. And it's really the repetitive nature of the flexion of the elbow over time that leads to the damage to the nerve if it isn't kind of dealt with sooner.